Chinese medicine sees hepatitis. Well, first off, it's a Western medical distinction. Itis reflecting inflammation. We talked about this during bursitis as well, you know. Itis means inflammation. It's got to have the 4 cardinal signs. Something's got to be red, hot, swollen, and painful. As long as you got that, you got an itis. Okay, where's the itis? In the liver. Latin for liver is hepa. So if somebody shows up with hot, sweat, swollen, painful, red liver, it by definition is a hepatitis. So that's the definition. It's in the grossest, most functional block. There's an inflammation in the liver. So inflames, inflammation, we play on that word in Chinese medicine. It's a hot liver. It's a liver inflames. It's inflammatory. It's an inflamed liver. So hot livers, you know, it can be, hot livers can be produced through alcoholism, emotional constraint, or external causes. So then now we get into differentiation of syndrome. So to talk anything further in Chinese medicine, we use a model called differentiation of syndromes. Is this something from the outside coming in or from the inside coming out? From the inside coming out for a liver fire could be internal constraint of the liver, as an example, or chronic inflammation. If there's a bad guy circling around in there, the body is going to respond. Now, as I was contemplating this, I really do think this is an external invasion. This is something from the outside coming in, creating heat on the interior of the body. Hepatitis primarily being that it's either fecal, oral, blood. It's something from the outside coming in. You either inject it with a needle or you take it in through your mouth, you get exposed from the environment. It's an external invasion, but it's particularly pernicious is the word we use in Chinese medicine. It's a virulent, pernicious heat invader. I mean, when it comes in, this thing rolls fast, it rolls strong, and it rolls hard. You know, it's interesting that it comes and goes, and that's part of the nature of liver gallbladder disharmony. But regardless, you get an initial, Chinese and Western medicine are the same in initial etiology. You know, in Hep A, B, and C, there may be, especially with A, there'll be, you know, an initial response, nausea and vomiting, and then it'll cool off after 3 to 6 months. In Hep B and C, it's the same thing with the right hypochondriac. We call it hypochondriac pain. Is what I really always wanted to ask an MD this. Right upper quadrant pain in medical school, was called hypochondriac pain. Do you guys say the same thing?
Normally, normally we call right upper quadrant. It is the right hypochondrium. Yeah, like
there you go. So is there a parallel between hypochondria? Well, we'll talk about that offline. It's not the subject of hepatitis. So right upper quadrant pain that's distending. That's the basic gist. That's just the area of the liver. That's the hallmark of our diagnosis. So it's an external thing coming in. It's really pernicious. It's really hot. And the Hep B and C, the main cardinal sign is going to be that tightness there. And, you know, they may or may not present with symptoms. Sometimes it's a silent invasion. Maybe they don't get an acute, you know, reaction initially. It may be till some years later that it comes out, which does highlight how stressed and opportunistic this particular virus is. Because it is opportunistic to stress and to decay, it offers a stronghold for Chinese medicine, because we could keep the liver blood circulating, keep the liver healthy so there's less opportunities. And we could teach people Tai Chi and Qi Gong to have stress management, you know, so it doesn't come back. So that's just an overview of Hep A, B, and C, starting from the perspective of 8 principles. They're all external invasions. Something from the outside coming in. Hep A is through the mouth. Hep B could be through the mouth. Hep B and C are from blood and from needles. They're all from the outside coming in. Chinese medicine's a holistic perspective. So hepatitis in a primary sense is considered a liver disease. Hepa means liver. I mean, so this is a liver disharmony. So the primary conditions in hepatitis from a Chinese medical perspective, we don't have serology. So we have a differentiation within the liver pathogenesis of liver qi stagnation, liver gallbladder damp heat, and liver yin deficiency are the 3 primary presentations of a hepatic person. The liver qi stagnation is going to present with the cardinal signs of chest distension, hypochondriac pain, and distension. That's the qi stagnation part. But the cool thing about qi stagnation people, they're going to have an urge to yawn and sigh. Uncontrollable urge to yawn and sigh. It's a way of clearing the liver stagnation energy out. they're going to have nausea, vomiting, and eventually, maybe not initially, but eventually with that liver energy getting so strong, the nausea, vomiting you're speaking of as a possible sign and symptom is actually a comorbidity of the spleen, stomach, and the digestion. Because when the liver comes into excess, the spleen, stomach has to process all that energy. What this means is there's more bile salts dumping into the guts. I mean, it's quite literally the energy from the liver has to be processed through the digestion. I mean, that's how the liver voids itself. So eventually it leads to digestive upset, nausea, vomiting, gas, bloating, diarrhea. Another cool thing about liver qi stagnation, sometimes it'll go up. So they'll have globus hystericus, is a Western medical term, which is plum pit sensation in Chinese, the sensation of a stuckness in the throat. And sometimes they'll get, so I mean, what else can I say? When liver qi gets stagnated, there's only 3 chances for that energy to resolve. The energy can go up to the side or it can go down. So if somebody's got hepatitis with liver qi stagnation, it can go up, causing globus hystericus. It could cause dizziness, vertigo, tinnitus, dry eyes, burning eyes. It could also cause dryness and heat in the throat and even ulcerated spots on the tongue, depending on how much heat's coming up. If it goes sideways, it could cause gastritis, irritable bowel, as we talked about, liver qi stagnation, irritable bowel. It could also create hiatal hernias because it goes over to the stomach. It's hot, it lifts. It can lift the stomach up through the hiatal sphincter, creating a hiatal hernia. Very interesting. These are the signs that would indicate that it's a liver qi stagnation related hepatitis. Now, the second primary etiology is liver gallbladder damp heat. This will also have the cardinal sign of chest and or hypochondriac pain with focal distension. It's a little bit more focal. Qi stagnation can move. The damp heat doesn't move around. The particulars that specify liver gallbladder damp heat is jaundice, fever. This one's interesting. Bitter taste in the mouth. And then it has the common signs and symptoms of decreased appetite, nausea, vomiting, from when the liver overacts the spleen, stomach. But it has one more unique characteristic, and that's itchiness and swelling of the genitals, all the way to yellow damp heat leukorrhea.
Wow.
So if that means it's a liver gallbladder damp heat etiology. And then the last of them is the liver yin deficiency. It's kind of secondary. I mean, if you have heat long enough, you're going to run out of water, right? So liver yin deficient hepatitis most likely is one that's had it for a longer period of time. It's going to have the cardinal signs and symptoms of chest and or hypochondriac pain with focal distension. But this one will have the unique characteristics of dry eyes and mouth, dry throat, 5-centered heat. This is a Chinese medical term, sweaty hands and feet and sweaty center of the chest. It's just a yin deficiency characteristic. If the liver gets dry, eventually the kidneys will get dry. So liver yin deficiency will eventually present kidney yin deficiency signs. So if they get to the point of 5-center heat, we not only have to treat the liver yin, but the kidney yin. And then the other unique characteristics of liver yin deficiency, the dry, brittle nails. The nails, the quality of the nails are a reflection of the liver. And if they're dry and brittle, then it's a dry liver, a liver yin deficient.
Nice.
I mean, it's got dry constipation and irritability, but liver qi stagnation is going to have the irritability. And then lastly, it's got the co-symptomology of decreased appetite, nausea, and vomiting with the liver qi affects the spleen, stomach. So that's the primary gist of hepatitis. I do want to mention one thing else is secondaries. If the liver gets that messed up, as I've already alluded to, you can get spleen and stomach signs, you can get kidney signs, you can get heart signs. That's where Chinese medicine can really help with hepatitis, because you guys, as we're going to talk about now, have wonderful treatment methods, both on the end of vaccinations and through therapeutic interventions. And life-saving is that. With hepatitis, I have lost friends to this disease. I'm like, let's give you guys first line of response. And then if it doesn't work, we'll do secondary. Unless somebody is absolutely adamant they don't want Western medicine in the treatment, which I've had, then I said, okay, I'll treat it. First, go to those guys. If you refuse, come to me, I'll do it. I'm not going to do it until you go to them first. If you won't go to them, come to me, I'll do it. So then we can free up the liver. We'll get into treatments in a bit. All right, so I think that's what we got.
Do you have one interesting question for me? Do you have anything on this dark urine pale stools? I mean, this is advanced.
Yeah,
stage stuff.
Well, I mean, the dark urine, that's a harbinger to the liver yin deficiency aspect.
Okay, cool.
I mean, that just qualifies it into the subcategory that there's heat in the urine, there's not enough fluid.
Mm-hmm.
It can be the damp heat, but with the damp heat, they're going to have itchy, swollen genitals with a lot of hot urine that's hot, that perceives as hot as they urinate. That's going to be the damp heat urination. Liver qi stagnation people, they're just going to, when they pee, it's just going to feel great. Because the energy goes out. You're like, oh, that was the best one ever. That's the liver qi depleting through urination. They're going to have that response. The scanty dark urination is the liver yin deficiency type. Now, as far as the pale stool, I mean, yeah, we were taught that. I mean, it's a blockage of the gallbladder from being able to create the bile salts, the color of the stool, the green-brown characteristic color. That's the bile. And because the liver's not functioning, it's not producing the bile salts. The gallbladder's not conjugating bile, and it's not coloring. So it's for us, white stool means call a doctor. But it's a clear indicator that's of a hepatitis condition, you know?
Yeah, cool.
But as far as like the pathogenesis of it, like the pathology, to answer your question from a Chinese medical perspective, the liver is essential for the storing of blood. And the darkness in the stool is in fact a blood sign and symptom. Mm-hmm. Western medicine agrees the spleen breaks up the old blood cells. Yep. The old blood cells go to the liver, get conjugated into the bile salts, and then pass through the gallbladder. So in fact, the coloring of the stool is blood. It's just broken down blood particles. So if the liver's not functioning as a storehouse of blood, then there's no blood to go into the stool, and the stool is rendered white because the liver's not functioning in its role of a storehouse of blood, which is what we call the liver. That's how a Chinese medicine practitioner would explain. From a Chinese medicine perspective, because we see it as a liver problem, primarily either liver qi stagnation, liver damp heat, or liver yin deficiency, depending on which of those we would diagnose it as through the associated signs and symptoms that we talked about. If it's liver qi stagnation, you free the liver qi. If it's liver damp heat, you drain damp heat from the liver. If it's liver yin deficiency, you tonify the liver yin. You could have liver yin deficiency with liver damp heat and liver qi stagnation. So you got to free the liver, drain the damp heat, and nourish the yin. Most likely, I also think there's another one, liver fire. Where's liver fire in the differentiation? I mean, all of them are going to, liver qi stagnation will lead to fire, liver damp heat will lead to fire, liver yin deficiency will lead to fire, any one of them. So you got to clear liver fire too, depending. That's kind of in the chronic episodes, the acute phase. Yeah, would be the liver fire. Although, so one strength of Chinese medicine is we could treat it in between when it's not an acute to help strengthen the liver and keep the liver moving, keep it clear of damp heat, and keep it moist with water so it doesn't tend towards heat. So that's a nice thing. We could treat it in between so that there's less acute episodes. And when it's acute is when it lends towards mutagenesis, when the cells start tweaking out because they're under such stimuli from all the heat and the viral load and all that. Like if we could keep it chill, there'll be less liver cancer. So we can do that through any of the 5 treatment methods of Chinese medicine. There's movement therapies, such as dragon and tiger Qi Gong, Yishui Jishui Jin Qi Gong. There's all sorts of Qi Gong methods that are movement methods to clear liver fire. Those 2 forms in particular would be good for movement. But diet therapy is lovely for the liver. As an example, is just cucumber-soaked water with mint tea with a little twist of lemon rind. There's a 3-herb combination called Sinisan that's used for Raynaud's syndrome, cold hand and feet, to disperse the liver energy to warm the hands and feet because it's too much holding the liver. Disperse the blood, the hands and feet get warm. That's the same basic principle for the liver with this dietary thing. You got 1 herb to guide it to the liver, 1 to cool the liver, 1 to disperse the liver. The cucumber moistens, the mint is cooling, and the lemon disperses. So it's a dietary method. And then you mentioned dietary, lay off the alcohol, lay off the buffalo wings, no spicy, greasy pad thai, no drunken noodles with chili pepper and Szechuan sauce, none of that stuff. That's all got to be processed through the liver. Creates heat in the liver and so dietary. Herbs are fabulous and phenomenal, but once again, they get processed through the liver. So thank God we have Western medicine to check the viral loads and the amount of immunoglobulins. So as we give a herbal regimen, do regular serology exams to make sure the liver is actually cooling off and not upregulating with the process of the herbs. But we got great herbs to disperse the liver qi stagnation, Sini-san, Xiaoya-san. I mean, there's a bunch of them. And then to drain liver, gallbladder, damp heat, we have herbal formulas in that realm as well. Longdan Sheigantan is one of the most prevalent. The thing with Longdan Sheigantan is it clears the heat through urination. So you tonify the liver yin through herbs. Li Wei Di Huang Wan is one of the cardinal formulas for that. W Yin Wan is another wonderful herbal formula for that. No, so that's and then acupuncture as well is great to soften the liver and to cool the liver. Oh boy, can we cool the liver off. Below, Dajue, the Great Mound below C7T1, great place to clear heat. Liver 14 right over the liver. Gallbladder 25 at the tip of the 12th rib head to release the gallbladder. Liver 2, liver 3, liver 1, any one of those. Gallbladder 41, any of the Qi cleft points to clear heat from the organ, or the Hussies to clear heat from the organ proper itself using the Shu command points of acupuncture. There's points have different functions. So look up the Shu command points, the Hussi points, clear heat from the internal organ itself. So either gallbladder or liver Hussi points. So that's the acupuncture treatment of this disease.
And would you do needle techniques as well, just to not just...
Oh, absolutely. All our Chinese physicians said, you Western guys, you stick the needle in, think the needle's going to do it. You got to do it. Use your qi. What are you doing? Are you moving it up, down, in, out? Do it. You think the needle's going to do it. No, it's an antenna. It's an amplifying device. So yeah, grab the energy, get the energy, pull it, send it, direct it, flick it, snap it, pull it out, bloodlet it. Ooh, well, don't do that with hepatitis. And it's a joke. It's a joke. Actually in China, they had a really bad, as I understand, I can't prove this is historical fact, but there was a period of association with acupuncture and hepatitis B transmission. Because there was a period of, and when I worked in the hospitals in China, I did witness that they boiled the needles rather than autoclaving the needles, and they reused needles boiled. Doesn't do anything to the viral code of a hepatitis virus. Yeah. So in the West, we're required to use sterile needles, single use, disposed, and incinerated. There's not even a chance to reuse them because they burn them. So there's no chance of hepatitis transmission. Although when I was in China, I was told if you want to go get acupuncture, buy your own needles and bring them with you, and insist they use your needles. And then it's not an issue. Yeah. All right, so getting back to the treatment of hepatitis A or B, through the 5 treatment methodologies, I'll qualify them now, diet therapy, herbal therapy, movement therapy, acupuncture therapy. What's the last one? Diet, herbs, movement, acupuncture, massage. So I can massage the liver and drain the liver. Often when I work on hepatitis people, I can pull a lot of heat out of the liver. Now the question is, how do I do it? So for instance, I had a hepatitis client, I brought the energy downwards, and she ended up with a huge flare-up of polycystic ovarian syndrome and uterine cysts and herpes lesions.
Jeez.
With what's the word? Too much bleeding during menstruation.
Menorrhagia.
Yeah, menorrhagia. Yeah. So I pulled the heat out. It worked, but as the heat came out, it created a lot of symptoms. And then there's another one, a hiatal hernia person. I cleared it out. I tried to bring it up and down, but it just, when the water rains, it goes through the channels where it's rained before, So she had a agitation of hiatal hernia when I dispersed her liver heat as a body worker. Now, this isn't a common thing. This is like 1 out of 100, or 1 out of 1,000, but it does happen.
Yeah.
Most of the time I pull it out the fingers or the toes. You could scream it into a pillow. There's ways to get the liver heat out. So body work is useful. Now, the last thing is, again, I wanted to mention Chinese medicine can really support the care of hepatitis by doing secondary symptomology. We can clear the heat from liver. We can move the liver. We could help with irritability. We could help keep the liver cool so it doesn't get inflamed. You guys treat it with your antivirals and then send them to us so we could help with the associated symptoms. For instance, the nausea, vomiting, decreased appetite, loose stools, diarrhea, we can treat that. We can treat that. Chaihu Shugan one, Sini-san, Liu Jensi one, We have acupuncture and herbs to treat those associated signs and symptoms. And then once again, if in the end stage liver, it can go up. It's so hot, the fire's going everywhere. Mingmu Di Huang Wan, Qiju Di Huang Wan. We got herbal formulas to clear liver heat that are going to the eyes, creating dryness in the eyes. And then we could also bring in extra herbs to moisten the tissues. So there are a lot of diet and lifestyle and acupuncture and movement methods that could be used to help the signs and symptoms as you guys are doing your vial treatments. And then I think we got a really strong approach.